Hello students, you will discuss today very common cutaneous condition which we come across but benign. So identify what this condition is. Look at that, pigmented, some elevations and warty surface is there, very typical. What is this condition is? So this is seborrheic keratosis. Black curd, well localized thing, very common, especially in old people. And in the face it is common, back, skin it is common, and exposure areas it is common. But it's not solar keratosis, remember, that is a pre-malignant condition, but it is not pre-malignant condition. This is a very, very benign entity, especially in old people it is very, very common. But the important thing you have to remember is the differential diagnosis, melanoma, pigmented BCC, pigmented SCC, other nevus, other pigmented lesions, which needs a warning sign, which needs a monitoring or excision or biopsy. So benign overgrowth, the basal layer of epidermis, the all layers of the epidermis, 5 layers are there. Common in elderly, slow growing, pigmented, common in Caucasians, stuck-on appearance. The look is stuck-on appearance. It's a very typical clinical look. That's the word used. It is not a pre-malignant condition. Now, important thing you have to remember, melanoma, malignant status, pigmented BCC, pigmented SCC, nevus, solar keratosis is a pre-malignant condition. They differ from this. Understood? Now, treatment here is, of course, excision under local. Always send it for with HPR because you have got all these differential diagnoses. So, this is a very, very common entity, especially in elderly. Multiple is very common. Remember, seborrheic keratosis, it is entirely benign entity, but solar keratosis is a pre-malignant condition. But remember, different malignant condition of the skin tumors as a differentiator because you have to rule out that one. That's why excision biopsy is quite important when you suspect malignancy. Otherwise, this condition is entirely benign. That point you have to always remember. So go through my clinical methods, how to examine skin lesions, skin diseases. Go to my manual in detail about the skin conditions, everything skin conditions, surgical detail, melanoma, squamous cell carcinoma, BCC, other skin tumors, benign tumors are discussed very well. And my operative surgery gives how to remove all these swellings. Now suturing technique is important. Again, my our lectures in surgery, everything covers for UGs and basic for PG through JP publishers. So I hope you understood this basic skin condition, common seborrheic keratosis. Students, thank you very much.